Welcome to the Mindful Practice Podcast, a space for physicians navigating burnout, identity shifts, and career change without pressure or judgment. I'm your host, Dr. Bertina Hooks, a board-certified internal medicine physician, coach, and writer. Here we talk honestly about what it means to build a sustainable career and a life beyond medicine and survival. Before we get started, I wanted to share something important. The Mindful Practice Podcast is now part of the Pinnacle Podcast Network, which means you can earn free CE and CME credit just by listening to these conversations. This is about making physician education more accessible, more practical, and actually aligned with how we grow in our careers. I'm Dr. Bertina Hooks, and this is where high-performing physicians come to rethink how they practice, lead, and live. You can find details on how to claim your CE or CME credit in the show notes. Now let's begin the next episode. Hello, and welcome back to the Mindful Practice Podcast. I'm Dr. Bertina Hooks, and today I want to talk about something that many physicians experience, but often do not name clearly enough. And that is the permission to evolve. Because one of the hardest parts of growth, especially in medicine, is not necessarily knowing that something in your life or career needs to shift. It's giving yourself permission to become someone different from who you originally thought you had to be. Medicine trains us to commit. It trains us to endure. It trains us to push through discomfort, uncertainty, fatigue, and sacrifice. And many of those qualities serve us well. But what medicine does not always teach us is how to recognize when growth requires change. And change can feel deeply uncomfortable for physicians because many of us have spent years, sometimes decades, building an identity around being dependable, capable, high achieving, and committed to a very specific version of success. For many physicians, the path has been so structured for so long that even considering another possibility can feel disruptive. You move from pre-med to medical school, residency, fellowship, attending life, and for years, success is defined by staying on track. So when your internal life starts asking different questions, that can feel almost disorienting. So when something inside us begins to shift, when our priorities change, when our definition of fulfillment looks different, it can feel unsettling, sometimes even frightening, because now you are no longer simply asking, "What am I doing?" You are asking, "Who am I becoming?" And that question can create a lot of internal tension, especially when the world around you still expects you to remain the same. There are many physicians who know they have outgrown certain spaces. They have outgrown certain systems, certain ways of practicing, certain expectations, certain definitions of success that once felt important but no longer feel aligned. But instead of honoring that growth, many physicians begin questioning themselves. They wonder, am I being grateful? Am I being ungrateful? Am I giving up too soon? Why can't I just be satisfied? What will people think if I want something different? And often, underneath all of that, there is guilt, because medicine teaches us that perseverance is noble, and it is. And perseverance without reflection can also keep people stuck in places they've already outgrown. Sometimes evolution does not mean leaving medicine. Sometimes it means practicing medicine differently. Sometimes it means stepping into leadership. Sometimes it means teaching. Sometimes it means writing. Sometimes it means entrepreneurship. Sometimes it means advocacy. Sometimes it means finally allowing yourself to build a life that reflects the fullness of who you are, not just the role you trained for. In my own journey, permission to evolve has happened more than once. It has happened when I realized my first path in medicine was not my final one. I shared that I have matched twice, the first time in obstetrics and gynecology, the second time in internal medicine. I decided to shift professional direction. I liked both specialties very much. And when I did the initial match, I actually applied to both internal medicine and obstetrics and gynecology residency programs. However, I decided to rank the obstetrics and gynecology program higher since I felt it was my true calling. At that time, I decided after my first year of obstetrics and gynecology residency to transition into internal medicine after a particular patient encounter that made me realize that I wanted to do internal medicine. While I was a OB-GYN intern, I had an experience with a patient who went into postpartum cardiomyopathy. Now, before medical school, cardiology was always a career that I had envisioned myself to become. I wanted to be a cardiologist since I was a teenager, long before I had applied for medical school or residency. However, when I was in medical school, I started to doubt myself, and imposter syndrome started to creep in. I felt that I wasn't capable of becoming a cardiologist. However, the passion still burned deep in me, and so I decided to reapply for internal medicine in hopes of applying for a cardiology or pulmonary critical care fellowship. That was a pivotal moment in my career because I loved medicine in different forms. I loved the aspect of being a surgeon. I loved women's health, but I also loved internal medicine. I loved the fact that I could diagnose and treat problems in a systematic way. And so, as a result of my passion for cardiology and pulmonary critical care, I decided to switch my specialty and re-enter the match. This happened again when leadership became important to me. It also happened when I recognized that coaching physicians and building meaningful conversations through this podcast and writing were not distractions from medicine. They were extensions of my purpose. In December 2022, I started to explore leadership. First, I explored it in the hospital medicine sector, where I was actively practicing. I wanted to become a hospital medicine program director or associate program director. But once again, my doubts and my fears led me to not apply for those positions, leadership positions, even though I knew that I was a natural leader and I had the skills that could be developed into an effective leader. It wasn't until I transitioned into utilization management that I really started to see myself as a physician leader. That experience helped me to define who I was and my goals to become a certified physician executive. And there was a lot of colleagues that encouraged me to do so. And as a result, I applied, I was accepted, and I started doing my Executive Masters of MBA in 2024. And my ultimate goal is to become a certified physician executive through AAPL, and then eventually become a chief medical officer. As far as coaching was concerned, it was a natural progression. I had already been mentoring and advising informally medical students, residents, and peers. And so the coaching became a natural progression for me because I benefited from coaching as well, and the self-reflection and guidance that's required. I utilize coaching to help with my career transition, and the experience and knowledge I gained helped me to become a physician coach, building meaningful conversations through this podcast as well, which I've used as another vehicle to educate, advise, and uplift other physicians that were struggling with similar things that I was. While these things became important, leadership, coaching, writing, hosting a podcast, building meaningful conversations through this podcast also became important. Writing became important, and it influenced me to create my memoir. All of that required internal permission to evolve because no one hands you permission. No one formally says you are allowed to grow. You are allowed to redefine what success looks like. You are allowed to build differently now. That permission often has to come from within. Many physicians delay growth because they believe clarity must come first. But often clarity comes through movement, not before movement. Sometimes the next version of your life requires courage before certainty. And that can be uncomfortable because physicians are trained to want answers before action. But growth rarely works that way. There's a difference between quitting impulsively and evolving intentionally. Evolution is thoughtful. It is often slow, and for many physicians, it happens long before anyone sees it externally. And sometimes before we evolve, we grieve. We grieve the original version of success we imagined. We grieve old expectations. We grieve identities that served us in one season, but no longer fully fit. Sometimes growth is uncomfortable because it asks you to honor a version of yourself that worked hard to get there, while admitting that version may not fully fit anymore. I want to say this clearly to anyone listening who feels that internal shift happening. You are not failing because you are changing. You are not disloyal because you are asking deeper questions. And you are not abandoning your profession because you are allowing your life to expand. Evolution is not abandonment. It is maturity. It is awareness. It is leadership. And it often is necessary. Physicians who evolve thoughtfully often become strong leaders because they are no longer performing identity. They are living with greater alignment. And as you continue your own journey, ask yourself, what version of success am I still holding on to because it once made sense, but may no longer fit? Where have I outgrown old definitions? What becomes possible if I allow myself to evolve? Because often the most meaningful growth begins when we stop asking for permission externally and begin trusting what is already developing internally. Thank you again for joining me on this episode of the Mindful Practice Podcast. Remember to allow yourself to evolve intentionally and purposefully. Allow yourself to dream big and to follow the natural evolution of your career. You are enough. You have the skill set and the values and beliefs to achieve whatever you want to desire. Don't put limitations on yourself because of fear or doubt. If you had asked me 5-10 years ago, would I be doing a podcast? Would I be an author and a publisher? Would I be trying to coach and lead others towards fulfilling their destiny? The answer would have been no. I was quietly content with being a clinical physician full-time. I had fulfilled my idea of success. But as I achieved each of these milestones, I learned that success evolves. And as I grew as a clinician and a human being, I wanted different things. And there's nothing to be apologetic about that. Until next time. If this conversation resonated with you today, there's now an added benefit. You can earn free CE or CME credit by listening to this episode through the Learn at Pinnacle app. This is a part of a larger shift towards more accessible real-world physician education, and I'm proud to be part of it. You'll find all the details in the show notes, including how to access the app and claim your credit. And if this episode helped you, share it with a colleague who needs to hear it. I'll see you in the next episode. Thank you for listening to the Mindful Practice Podcast. If today's episode resonated with you, you can find free burnout and career clarity resources at pinnaclebusinessacademy.org. And if this podcast supported you, please consider subscribing or sharing it with a colleague who might need it. Remember, you are more than your white coat. You are not broken, and you are allowed to evolve. Until next time, take care of yourself, not just your role.